Hi, my name is Chris Quarto, and I'm a professor in the Professional Counseling Program at Middle Tennessee State University. I think you'd agree that supervisors can have a dramatic impact on the professional development of counseling students, as well as counselors who are working in agency and clinic settings. Just think back to some of the supervisors you had in your training as a counselor, and you can probably think of things that happened with them that, for better or worse, influenced your development as a counselor. You know, what's interesting to me, more and more master's level counselors are being thrust in the position of supervising graduate students or less experienced colleagues in agencies without having received any formal training in clinical supervision themselves. We've taken a proactive approach at MTSU to address this problem by training mental health counseling students in the fundamentals of supervision during their internship year. And some of the things we address with them will be illustrated in this continuing education CD. There are a lot of good supervision models out there, but the one I'm going to touch upon today is Janine Bernard's discrimination model. And this is a particularly good model for you to learn about in your role as a supervisor because it's pretty easy to understand, it's atheoretical, and it's practical. Here's the main thing you need to know about the model. It describes three areas of focus that you can address with supervisees and supervision, as well as three different roles you can adopt as a supervisor when you're discussing these things. Tell you what, this is what I'd like to do. Let me briefly run through the areas of focus and roles, and then my former graduate student Jen and I will illustrate how you might go about implementing these in supervision sessions. All right. There are three things you can essentially focus on in supervision: the supervisee's process skills, conceptualization skills, and personalization skills. And let's take a look at process skills first. When you're addressing process skills, you discuss with the supervisee how they're going about conducting counseling sessions, as well as anything that might be having an impact on the counseling process. And this can involve a lot of different things. It might involve helping supervisees learn the steps in conducting an intake interview, or recognizing when it's most effective to confront a client on some issue based on what's occurring in the counseling session. Or maybe you're going to focus on helping the supervisee make better use of basic counseling skills like reflections or probes or interpretations to facilitate the counseling process. Or maybe on a more advanced level, you'll help the supervisee identify countertransference issues that are affecting the process of counseling. So anything that impacts the counseling process would be one of the areas of focus in supervision. Now, another thing that you'll focus on is the supervisee's conceptualization skills. And here's what you're trying to do. You're trying to figure out whether the supervisee has a handle on why a client has a particular problem and what the best course of action is in tackling the problem. So in other words, why is it that the client doesn't get along with people? How has the problem been established and how is it being maintained? So what I'm going to be doing here is listening to the supervisee's explanations for a client's problems in the context of the client's background, environmental factors, genetics, and so on and so forth. And by the way, here's another thing I'm going to be listening for in supervision. I want to find out if the supervisee can identify themes in discussions with the client and whether the supervisee is obtaining any kind of data that either confirms or disconfirms his hypothesis pertaining to that problem. And then after you've had these discussions, one of the most important things you'll do is consider whether the treatment intervention the supervisee selected is the best fit for the type of problem a client has based on the conceptualization of the problem. So a client's understanding of the problem, a supervisee's understanding of the problem and ways of helping a client resolve the problem is what you'll be focusing on with conceptualization skills. Okay, the last area of focus has to do with supervisee's personalization skills. And your task here is to figure out how a supervisee's personal characteristics affect counseling sessions. So in other words, what are some of the supervisee's dominant personality traits and how do they affect his style of relating to people? Does a supervisee have the ability to keep himself from getting wrapped up in countertransference issues? So here's what you're doing is you're looking at what the supervisee brings to counseling in terms of his person. how this affects the counseling process, and then determining how these characteristics work to his advantage or disadvantage. And you know, one thing that might help you is to be sensitive to how the supervisee impacts you in supervision. So in other words, what kinds of feelings are you picking up on when you interact with the supervisee? And is it possible that clients are affected the same way? And if so, is this something that needs to be addressed in supervision? These are all personalization issues. All right, there are 3 areas that you can focus on in supervision, but how you go about doing this is going to be based on the type of role that you adopt with your supervisee. And Bernard talks about how supervisees can function in 3 roles: the teacher, the counselor, and the consultant. So let's take a look at these next, and then Jen and I will role play some scenarios which illustrate different combinations of roles and areas of focus. If you function in the role of a teacher, you're essentially taking more of an instructive role, which means that you're going to be providing supervisees with information that you think is relevant to helping them learn a skill or develop a better understanding of something pertaining to a client or what they're doing with a client. So there's guidance that's involved here, and usually your goal in adopting this role is to help the supervisee perfect a technique or to sharpen their clinical acumen. And you can decide the best way to do this. At MTSU, we do this by listening to audio recordings or watching videotapes, or provide live supervision while students are conducting counseling sessions, and then talking to supervisees in individual and group counseling sessions about what they did and what they could do differently the next time to improve their skills. Now, sometimes what will happen is that the supervisee will bring up an issue and it'll cause you to shift more to a counselor role. Now, I want to be clear about something. When Bernard talked about adopting a counselor role, she didn't mean that you actually counsel the supervisee on personal issues. In fact, that's something that's usually frowned upon from an ethical perspective. What you're trying to do is help a supervisee identify how certain personal issues are affecting his work with clients, and then doing some problem solving to figure out ways of dealing with these dynamics so they don't have a negative impact on the work that they're doing with the client. So in your role as a counselor in a supervision context, you help the supervisee become more aware of how his intrapersonal and interpersonal issues are impacting the counseling process, and help him determine how best to address these when working with clients. Now, it's entirely possible that you may not enact the roles of teacher or counselor as much as you do the consultant role, which is the 3rd role. Remember how I said before that when you operate in the teacher role, that you're providing a lot of instruction and guidance? Well, that kind of role implies that you're an expert, and the supervisee is more of a novice who needs direction and oversight. It's almost as if you're in a one-up position on the supervisee. Well, when you're interacting with the supervisee as a consultant, you're essentially operating as peers or colleagues. You're on equal footing, in other words. So you're much more likely just to bounce ideas off from one another and discuss things like interventions that can be used with clients, or ways of conceptualizing cases with the intention of helping a 3rd party, that client. But remember, you're essentially at equal status. Okay, there are a few rules of thumb I want to mention pertaining to the discrimination model, and here's the first one. First rule of thumb as a supervisor is to adapt your role and focus as the situation mandates in supervision sessions. You know, the reason this is called the discrimination model is precisely because the supervisor makes discriminations as to which role will work best with a particular supervisee when they're discussing a particular issue. You basically tailor your role based on the supervisee's needs at any given point in time. So what ends up happening is that roles and things that you end up focusing on are going to be changing not only across supervision sessions, but even within a supervision session. Okay, this would be a good time for Jen and I to illustrate how all of this works. If you take into consideration the 3 areas of focus in 3 roles that you can adopt as a supervisor, It results in a 3x3 matrix that you'll see in the PowerPoint in terms of how you interact with the supervisee. And the thing is that your style of interacting with one supervisee may be totally different from how you interact with another supervisee, once again, based on what that supervisee's needs are, what role you adopt, and what issue you focus on at any given point in time. Now what we're going to be doing is we're going to illustrate 3 cells of the matrix that will provide a good mix of the different areas of focus and roles. The focus of the first role play will be on what's called process skills, and I'm going to interact with Jen in a teacher role. Jen, tell me a little bit about this client that you're seeing. I know that you've had some struggles using certain types of interventions, and you're wondering if this would be a good intervention to use with this client. Tell me a little bit what's going on.
Well, I've been working with this kid. He's about 15, and he is always complaining about how staff is kind of picking on him and calling him out, and he feels like they treat him unfairly.
Mm-hmm. Okay. Do you think there's anything to that? I mean, have you been able to observe staff and watch how they're interacting with him? Is there anything to that?
I don't really think there's anything to it. I think they mainly stick with the guidelines of the program. I don't think they're singling him out, per se.
Okay. All right. Well, I remember you asking me about the cognitive restructuring technique, which is something that might work out really well with this client. And let's just kind of go through that basically. You remember when you took the Theories of Counseling class, Albert Ellis's model for rational emotive therapy, and he presented the ABC model, which basically at A is some sort of an event that happens, you might recall that, and B is what is the client's beliefs or thoughts about that event, and then C is what are the resulting feelings or behaviors that occur as a result of those beliefs. Now the thing I wonder about with this client that you're talking about is if he's making some sort of maybe a mountain out of a molehill here. In other words, do you think there's a possibility that he's kind of blowing things out of proportion, that he's really thinking about these people that are picking on him or calling him out? Do you think there's a possibility that he's just kind of blowing this out of proportion?
Definitely.
Okay. So I think that if you wanted to, you could actually present this model to him and let him know that at that B point, that he may be misperceiving things, that he may be thinking about things illogically or irrationally, and then teach him different ways of approaching or thinking about the situation. Because if we can get him to think differently about the situation, that'll probably change the way that he feels and behaves towards staff.
So how would I go about getting him from thinking about these things to
Well, I think what your
practicing?
challenge is to get him to question himself. Whenever he does think that somebody's picking on him, to question himself about that, to even argue with himself, to argue with those types of thoughts, and maybe to replace them with more rational or realistic types of beliefs. Maybe saying things to himself like, well, maybe that could be true, but it's probably not. They're probably not really picking on me. It's probably just the way that I'm seeing that. That's what your job is to teach them how to argue with those thoughts and how to replace them with more realistic ones. What you probably noticed in that little scenario is that I was very teacher-like and instructive in how I interacted with the Jen, because that's what she needed at that point in time. The focus was on the process of counseling, or in other words, how she'll actually go about implementing the cognitive restructuring technique in a counseling session. Okay, the focus of the next role play will be conceptualization skills. But this time I'm going to switch my role to that of a counselor. Jen, I've noticed in the last couple of sessions that you've had with this client that you seem to be having some pretty strong reactions. This is the client that we're talking about here is the child who has been abused, and I've noticed that you've had some pretty strong reactions, in particular toward the parents. Can you tell me a little bit what's going on there?
Yeah, I kind of feel angry when I'm talking to this particular client, like I want to protect him from his parents, and so I kind of wonder, like, why am I working with the kid at all? I think I should be focusing more on working with the parents.
Okay. Are you angry at the child himself?
I'm really angry at the parents for the way they treat the child.
Tell me a little bit more about that.
Well, they tend to hit him sometimes, or push him when he does small things, even like not cleaning his room and, you know, not making it home on time and things like that.
And that really seems to make you angry, make you feel angry.
Yeah.
Where do you think that's coming from?
Well, I guess my dad was a little emotionally abusive with me, so I think maybe some of those feelings have come back up when I'm talking to this kid.
Okay, all right. That's got to be pretty tough for you to be dealing with your own feelings and trying to help a client who's had similar experiences to you.
Yeah, I kind of feel protective.
Okay, all right. Well, I think that what we need to do is we need to figure out ways that you can deal with your own feelings, because our primary concern here is for the client and for their well-being. So you and I will need to spend a little bit of time talking about how we can work through your own feelings for the betterment of the client. You'll notice in this role play that it was a lot different than the first one. It was much less instructive and much more focused on Jen's personal issues that are affecting her conceptualization of the client's problem. Okay, we're going to end this portion of the continuing ed course by focusing on personalization skills. And in this case, my role is going to be that of a consultant. Jen, you just got a referral, I noticed, on an adolescent client and his parents. And up to this point in time, I know you haven't done a lot of work with adolescents or parents. Most of your work has been done with children. Do you have any concerns about working with this family?
Yeah, you know, I'm a little uncomfortable working with these parents. I haven't worked with an adolescent's parents before, so I'm kind of unsure how to approach it.
Okay, so this new territory for you then, huh? Okay. Well, let's just look back at the work that you've done with the younger clients and their parents, and just focusing primarily on what you've done with the parents, because I know that that's a primary concern of yours with this adolescent's parents. Tell me some of the things that seem to have worked well for you in working with parents. How do you think that you've been so successful in working with the parents of the younger clients?
Well, I think with them, I've spent a lot of time just building rapport and building trust with them to form kind of an alliance for them to work with me.
Okay.
And that's worked pretty well.
Okay. So that might be something that you can use in this case, is because I know that that's a concern of yours, but if you look at it from the standpoint of, you know, what are my strengths and what can I use in this new context to be successful with this family, and in particular the parents, I think that that's not a bad idea at all. I read on the referral form that one of the main issues was the curfew, that this adolescent was breaking curfew a lot of the times. And I'm wondering what you think some of the main issues might be for the parents.
Well, I definitely would want to work on getting them to be less defensive when I suggest things to them. Also, probably they don't trust him very well if they're having issues with the curfew, so I would need to work on that with them also.
Yeah, that's a very good point, because if the whole issue right now is that they don't trust their child because he's been sneaking out or other things like that, chances are they're probably a little bit on guard. And meeting you for the first time, not really knowing who you are, it's probably going to take a little bit of time for them to develop trust in you. But the thing that I heard you say earlier, I think, is a really good point. The whole idea of developing that working alliance, developing that rapport with them, I think that'll go a long way in helping you that way. So that's good. Here, my role was different because I was trying to get Jen to use some of her personal qualities, things that have worked for her in the past, and to use those to her advantage. Her ability to develop rapport with people is excellent, and to use that to her advantage and simply adapt it for use in a new context. and to help her feel comfortable doing this. Well, I hope this portion of the Clinical Supervision Continuing Education course was helpful. This is one of many courses that we offer through the MTSU Center for Counseling and Psychological Services. In fact, the center's mission is not only to provide clinical services to community residents and MTSU students, but also educational opportunities to professionals. Don't hesitate to contact me if you'd like to take advantage of our other course offerings or to pick my brain about issues relating to supervision. Thank you very much and have a nice day.